I'm Dr. Kumar. I work with Medical Arts Clinic here at Parkland in Farmington. We, in the recent years, have been seeing a lot of people who come to our clinic in different stages of their life with concerns for abnormal bleeding. And a lot of times people ignore their symptoms of abnormal bleeding. And there are a lot of people out there. And we just wanted to touch base a little bit on when and when not to see a physician with concerns, when your bleeding is abnormal. And let's talk a little bit about that. So in a nutshell, when we talk about abnormal bleeding, we like to divide it in like three different groups, three different age groups. So the first group, of course, which we all know has, can be having abnormal bleeding, is the teenagers, or the people who have just started having their periods. And it's the time for great anxiety, but I think moms usually do a great job at, managing that. But so, for what I say in that age group is probably best to watch it for a year. And if your abnormal bleeding continues, then it could be something which is more concerning. And usually, if with the children being on your insurance, or if they're not on your insurance, it's a good idea to get it checked out with a physician. Just have an annual exam and kind of mention that and see if they're concerned about it. A lot of times, this is a great time to also touch base on contraception, because unintended pregnancies account for about 60% of pregnancies in the United States. So this is a great time to touch base on both of those subjects, get your contraception filled, and a lot of times abnormal bleeding could be something very simple which could be fixed by your birth control, and you get double whammy, and you can get your birth control and be protected. Talk a little bit in a more formal setting with a professional, and so your children or you understand in a different degree of seriousness about things that can go wrong around that time. And does it really need medical attention, or is it something normal, but still annoying and could be fixed by something as simple as birth control pills? Again, not everybody is eligible for that. A lot of people have risk factors, and that's why, even though there is talks about birth controls being available over the counter, it's not something that could be taken lightly, and so probably a professional consultation at least once a year is a great idea. And the great thing is the insurance covers your annual exams with zero cost. So for most people who have insurances, Medicaid or private insurances, this is what we recommend in those years. A lot of times there are other illnesses such as polycystic ovarian syndrome, which is more like ovaries have cysts or they have hormonal imbalances. And if you touch base on those, you can prevent long-term illnesses, infertility, prevent infections such as gonorrhea and chlamydia by just being educated with that visit. So that's in that age group. Now, when we move on to women who are more in their 20s and 30s and 40s, premenopausal, which means not having in the fertility years, abnormal bleeding comes in different shapes and forms. Most people will have regular bleeding, regular periods, regular menses around this time. But if you don't, then if you have too little periods, that needs to get checked out, because sometimes that is associated with elevated risk of cancer of the uterus over a long period of time. So that's not something that I recommend that you take lightly. Now, if you have too much bleeding, then that can have other issues such as anemia. You can have a lot of pelvic cramping. You could be hiding a disease such as, which we call as hyperplasia, which is technical, but all it means is that it can change its type of precancer of the uterus. So age 35 and higher, if you have any risk factors and you have abnormal bleeding, risk factors meaning smoking, precancer of the cervix, things like that, it's highly recommended. Go see a physician. This is something which could change your life. And a lot of times these testings will come back normal, but it's still very imperative to get that pelvic pain, get your abnormal bleeding checked out, because usually we do not have any screening for uterine cancer, and this is a great time. And this is probably the only reason where you want to go and check, in addition to just getting your annual and your pap smear, check the uterus and make sure you're not suffering from something abnormal. So So again, 35 and higher abnormal bleeding, absolutely go and get it checked by your physician, because it's not just annoying, it can have important implications for long-term health, such as precancer, cancer of the uterus, or in general like anemia and fatigue throughout your life. And it's something simple that your physician can do, which is not everything is a hysterectomy. Something simple like birth control pills or Provera or some other medicines like long-term, like IUDs can fix that. Now, when we head more towards menopause, 50s, the early 50s and the late 50s, especially the 60s, abnormal bleeding after menopause has significant implications. It could be spotting, which is usually due to something as common as, hey, I just have, everything is dried up. And it interferes with your reproductive life, with your life with your partner, but more importantly, it can cause a lot of pain and itching just because of that age group. And sometimes some people are eligible for hormones, but more importantly, any bleeding after you hit menopause for 2 years needs to be evaluated for cancer specifically of the uterus. And that's probably your only screening that you have, because other than those signs, uterine cancer will not give you a warning. And usually, if you don't have abnormal bleeding, then by the time we detect uterine cancer, it's stage 3. So if you want to get ahead in that game, if you have bleeding after menopause, there's no reason why you shouldn't be bleeding. You have to get it checked out. So what are the common things that your physician might do, and what are the red flags? So red flags are you went to a physician, had a general discussion about it, and turns out it's a hysterectomy. It could be true, but you might want to look more into that and make sure that everything has been done, because there are usually alternatives, and if there is no alternatives, that is a red flag. Or if your physician, if you go to your physician and more appropriate testing should be like blood work, pelvic ultrasounds, to look at the uterus and to look at the anatomy of the pelvis, and then a pap smear and endometrial biopsy, which is a biopsy which we do in office. It's crampy, but I wouldn't recommend Googling it because you might have a stroke after that. So, but it's not terrible. It's most people walk out of the clinic. All of them walk out of the clinic, but most people have mild cramping after the procedure itself. That's an appropriate workup for abnormal bleeding, is laboratory testing, your ultrasound, and a pelvic exam and biopsies. Just wanted to kind of touch base on this because a lot of people suffer from these things, and sometimes they have questions, should I see a physician or not? If you don't have periods every month, and you should, the answer is yes. And it might be something simple in your early ages, or it might be something simple but also really, really important, when you're hitting menopause. But those are the guidelines that we should follow. Here at Medical Arts Clinic, we have a lot of expertise, and we have the ultrasounds, and we have the biopsies and the type of physicians that you're looking for. As I said, most insurances will cover your annual visit, and this is a good time to mention if you are suffering from any of these things. And if you are, then go see your doctor, and that might help solve your issues.